Bismillahirrahmanirrahim. We're starting off with the unit pain. As we start with this unit pain, let me walk you through the syllabus first. If you have a look at how the syllabus looks like in the uh, how the syllabus looks like for this particular unit, this unit is again like all the other units that we have seen, studied, and come across, is divided into three different sections. The first section is about the types and theories of pain. The second one has to do with measuring pain, and the third one has to do with managing and controlling pain. And each section that we see has a couple of bullets. The first one we see has 2 bullets, and the second one has 3 bullets, and the third one has 3 bullets as well. And each section, sorry, has its own list of relevant issues and debates and methodologies that could be used to evaluate evaluate the content that we study in that particular unit. Now, having said that, if we get started, or before we get started, inshallah, our plan for today is to cover up this first section, that is types and theories of pain. Now, without any further ado, let's begin. If we have a look at the, or as we have a look at the uh, content for this particular section, we see initially we need to understand what the functions of pain are. And as we done discussing that, we'd have to move on and discuss the types of pain. And let's broadly divide them into uh, two categories initially, and then we'd add on a third to it as well. So this is the second thing that we need to cover. The third thing that we expected to cover is phantom limb pain. And along with phantom limb pain, we also need to understand the mirror therapy that was initiated, initiated by Ramachandran. This is the fourth thing that I'd want us to cover. The fifth, I'd want us to cover a case study by MacLachlan et al., and this is an example study. So I've just broken down the first bullet into 5 different parts, and this is how we'd be, inshallah, covering this. And once we're done with this, next we'd move on to the theories of pain, and we would simply divide these theories of pain into 2 different categories. That is the specificity theory and the gate control theory. So 6 and 7. Now, the relevant issues and debates and methodology that we need to know and be able to put to use as well are: number 1, the individual and situational explanation; number 2, nature versus nurture debate; number 3, reductionism versus holism; number 4, determinism versus free will; and the fifth one is a case study. Uh, Before I proceed, one more thing. This says relevant issues and debates and methodology for this topic include. They're using the word include, and as they use the word include, that in other words means you're not restricted to use just these issues and debates or strengths or weaknesses. I mean, you could use them, and you could use any strength, weakness, if it's any study, or if it's for the theories. And these theories, they have the strengths and limitations as well. So these are the proposed issues and debates that the examiner is suggesting you should know, but it is totally okay if you want to use any point besides and beyond this while answering your question. That works as well. Bismillahirrahmanirrahim. Let's start off with the functions of pain. What is pain? I'm sure everyone sitting over here does have an idea about what pain is, or what we mean when we're using the word pain. Pain kya hai? Pain dard hai, as simple as it could be. And pain is an unpleasant feeling. It's, of course, an unpleasant feeling. And we're talking about physical pain over here. Not only is it an unpleasant feeling, but at the same time, there are 2, if not more, functions, very important functions that pain plays as well. Now, if we speak about the important positive functions that pain uh, has, number 1, it acts as a warning signal. Now, as I speak about this as a warning signal here, let's just say uh, it's you walk into your kitchen at night, the lights are switched off, you want to grab a chocolate or a bottle of water from the fridge, and you're too lazy to switch on the light. And as you enter the kitchen, sooner than you realize, you bump into uh, anything that's there, and it hurts you, and it hurts you bad. Now, this is again a warning signal for you. How is it a warning signal for you? Because this is telling you that something you're doing or something that you've done was harmful. I mean, you are then expected to, as a natural reaction, you then be a little careful with that particular foot, and you would not want to repeat that behavior again. So, number one, pain acts as a warning signal telling us that something we're doing may be harmful and that we should stop to prevent further damage, right? कोई भी हमें चोट लगती है तो फिर हम थोड़े केयरफुल हो जाते हैं उस लेट्स जस्ट से बैंडेज वगैरह लगा देते हैं उस थोड़े टाइम पीरियड के लिए. Then we're a little more careful with that particular part of our body. Could be your toe, could be your elbow, could be your knee, anything, right? One. Number two, pain helps us learn from the experience. Now, learning from the experience, learning what? Learning from the experience in the sense that now that you've learned through a bad experience that uh, not switching on the light might not be the best of decision. If you're walking into your kitchen, this is an experience which would again prevent you from repeating that sort of behavior again, so that the likelihood of you experiencing an injury again reduces. So one, pain acts as a warning signal telling us that something we're doing may be harmful and that we should stop to prevent further damage. Number two, pain helps us learn from the experience by making us less likely to repeat. So this makes it less likely for you to repeat the behavior that caused the injury at the first place. Now, taking this ahead, like I had mentioned initially, we'd speak about the functions of pain, and as we've spoken about the functions of pain, let's move on and talk about the different types of pain. Now, broadly, we could divide these different types of pain into two categories. And yes, we'd add on a third category to this as well, phantom limb pain. But before we proceed with phantom limb pain, I'd want us to have a basic idea about the difference, the distinction between acute pain and chronic pain. So there are two main type of pain. I'm not saying there are just two types of pain. I'm saying there are two main types of pain that we refer to as acute pain and chronic pain. And as we talk about this acute pain, this example that I was just giving you of you bumping your foot into something in the kitchen, this is an example of an acute pain because this has a sudden onset, because this has a short duration, because there's a specific cause to it, and you get relief uh, pretty soon and relatively sooner as compared to chronic pain. And this is easily treated. On the other hand, if we speak about chronic pain as compared to acute pain, is has a lasting effect. This lasts a long time. In many cases, it goes for months. So there are some literature that says this, that suggests that it takes at least a month. There is other that says it takes at least 3 months, and in some cases, there have been people experiencing chronic pain uh, for years. Now, taking this ahead, this chronic pain, as we use the word chronic, it's very it's easier. It's easy, and the likelihood of you getting confused over here should be less because you're using the word chronic, and this is persistent. This is persistent pain that you experience. This is hard to treat, and an example of this could be you experiencing you having arthritis. This not only is difficult to manage, but this type of pain, it has been seen that this affects you with your day-to-day functioning as well. That you experience fatigue, you experience stress, you cannot do what you're expected to do, what you've been supposed to do. It affects your life socially, it affects your life professionally, it affects you overall. So the core distinction between acute pain and chronic pain. Acute pain, for example, like I gave you an example, injury could be an example of acute pain, and on the other hand, uh, arthritis could be an example of chronic pain. Now let's list these down, and so that it's easier for us to learn what we're doing better. Bismillah ar-Rahman ar-Rahim. As we speak about acute pain here, this begins suddenly and usually lasts for a short period of time. This can be severe, but does not usually last very long as compared to chronic pain. This often occurs in a specific part of the body. This usually has a clear cause, such as an injury or an illness. This is generally easier to treat using pain medication, changes in the behavior or environment, and therapy such as physiotherapy. And on the other hand, as we speak about chronic pain lasts for a relatively longer time, usually 1 month or even more, could turn into a couple of years as well, often difficult to treat and may not respond well to medication. This is important. This may not respond to medication easily. Number three, this can be caused by a long-term physical strain or exertion, could be because of any chronic illness such as cancer. Khuda na khasta. This can have a strong impact on your quality of life, on the relationships you have, the mental health. Imagine someone experiencing constant fatigue, constant stress. This might turn into your overall quality of life being impacted in a very negative manner. So you all might as well just take screenshots along, just in case if anyone's interested in having the content that you see on the screen. And as I say what I did, uh, it's totally fine. It's totally okay. In fact, it's good if you're reading it through the book. Books are equally good. And the Cambridge Indoors book, that is a course book by Julia Russell's, that works pretty well. And reading through the course book and learning content thoroughly from the course book to be able to evaluate, analyze, interpret, and apply can help you get not only an A grade and A star as well. So we were following our syllabus, and we were doing the first section from the unit pain. That is the third chapter from health psychology. Initially, we spoke about what pain is, followed by us trying to have an understanding on what the functions of pain are, followed by the two different types of pain, that is acute pain and chronic pain. Now, taking this ahead, let's move on to an unusual category that we refer to as a phantom limb pain. Now, what is phantom limb pain? As we speak about phantom limb pain here, phantom limb pain is a type of pain that is experienced by people who have lost a limb, amputees, or people who could be because of an injury, people who let's just say encounter an accident, they lose a limb, they lose an arm, they lose a leg, and now they do not have that particular limb. Imagine someone not having a particular limb and still experiencing pain in that particular limb. And this pain is real. And as we speak about phantom limb, people who are amputed, uh, more than 70% of them, they say they experience phantom limb pain. And phantom limb pain is pretty specific. Phantom limb pain is real, like I said, and phantom limb pain is bad because you don't really have you don't really have a way to get done, get. You don't have a way to treat it. You don't have a way uh, and not you don't have a usual way to treat it, let's make it like that. And medical science does not help you much when it comes to you experiencing phantom limb pain. Now, because this is new, because this is unusual for most of you, let me re-say this. आपकी बॉडी का एक पार्ट खुदा न खास्ता किसी वजह से you've lost it, not you, anyone, right? Anyone that you know of has lost a part of their body, a limb. And despite of the fact कि वो बॉडी पार्ट नहीं है, physically exist नहीं कर रहा, you're still experiencing pain in that particular body part. Now, to give you an example, let's just say this is my arm, this gets imputed from here, God forbid. But if it does, it's what I'm talking about is now I have an arm, but I don't have this hand. This is imputed. And despite the fact that this hand does not exist, I still feel and experience pain in parts of this hand that physically do not exist. Is this real? Yes, it is real. It is it common? Yes, it is very, very common for amputees. And is it bad? Yes, it is super bad. And it makes it worse because medicine doesn't really give you that relief or the treatment that you expected. expect to receive. Now, taking this ahead, Bismillahir Rahmanir Rahim. Phantom limb pain, like I said, is a type of pain experienced by people who have lost a limb, such as an arm or a leg. Even though the limb is no longer present, the person still feels pain as if it is coming from that missing limb. This can be a common problem after amputation. Phantom limb pain is often difficult to treat, and some people may experience it for many years or even for the rest of their lives. One treatment that has shown some success in reducing the pain is a mirror treatment. Now, mirror treatment, this idea was initiated by Ramachandran, and this is a very unconventional and unconventional way to treat it. But Ramachandran himself claims that yes, there has been scientific research into this as well. And despite of the fact that this is unusual, despite of the fact that this is uh, not ordinary or conventional way to treat pain, it still works. Now, what is amputation? Amputation, आम जबान में आपका हाथ अगर ये हाथ यहाँ से कट जाता है तो that means this is amputated. This hand physically does not exist. So being amputated. One treatment that has shown success, some success in reducing this pain is mirror treatment. And what is this mirror treatment? It is in fact, before I proceed with that, I want to show you a question that we've had on this, not specifically on this, but there has been a 6-mark question that we've had that says, describe the following types and theories of pain. Now, describe the following types and theories of pain. On this is a typical 6-mark question, and you all by now should know or would know that a typical 6-mark question is followed by a typical and by a typical 10-mark question where you're expected to evaluate. Now, see, describe the following types and theories of pain. This first bullet that you see over here, this refers to the different types, that is acute pain, chronic pain, and phantom limb pain. And the second one is the gate control theory of pain. Now, why is it that I've opened this? One more reason why I've opened this is, let me take you back to the syllabus. If you have a look at the syllabus, now what the examiner is expecting from us is, let me just wipe this out. Maybe, yeah, I'll just wipe this out so that you know. Okay, so this is what we're doing right now. This is what our lesson for today would comprise of. And okay, I did not want this to be colored. Okay, so this is the part that I'm interested in today. So if you have a look at this is what the examiner has asked you to describe this, and this from the first bullet. And then the examiner has asked you to describe this from the second bullet. Now, what I've highlighted over here in yellow is what the examiner has demanded from you. First thing worthy noted over here is, I mentioned this before as well, you could get a typical, you could get a 6-mark descriptive question where the examiner decides on picking up content from 2 different bullets. This is what I'm talking about. So the examiner has very specifically referred to the different types of pain, or ye types of pain he hai, acute pain, chronic pain, and phantom limb pain. And then the second bullet comprises of theories of pain, jahan pe examiner ne specificity theory ko chhod ke gate control theory के ऊपर knowledge आपसे demand की है. So this again, if this is a 6-mark question, how do I cater to this? I try answering this what 3 marks, and the other part I expect myself to answer this what 3 marks as well. Now, what is to be understood, and why is it that I specifically opened this, was to show you that was actually to show you content on phantom limb pain, but at the same time know that you could get a question where the examiner demands knowledge and understanding, because this typical 6-mark question, this is a question that is trying to test you on your knowledge and understanding, जिसे हम उर्दू में रट्टा भी कहते हैं, on rote learning, that is, on a particular topic. So phantom limb pain, this is what it was. This occurs when an individual who has lost a limb still experiences pain as coming from that area. And like I had said, this is very, very specific. Like खुदा न खास्ता किसी का हाथ नहीं है, तो you could feel pain, excruciating bad pain. in, let's just say, any one finger, could be the, what do you call it? The index finger. So occurs when an individual who has lost a limb still experiences pain as coming from that area. It is very difficult to treat successfully. Some sufferers experience success with mirror treatment, where the remaining limb is, and we talk about this mirror treatment ahead. Success with mirror treatment, where the remaining limb is put into a box with a mirror down the middle. When viewed at an angle, it looks to the patient if they have two intact arms or legs. The patient then takes part in range of movement exercises, and this eventually leads to a reduction in phantom pain in some patients. Okay, now let me just take this opportunity, since I have this open over here already. Let's just clean this, wipe this, and now I'd highlight the content that we have on mirror treatment. So that is what we were to do now, next in line. So what is a mirror treatment? Now, this is the marking scheme. We have this marking scheme open from November 2025, variant 3.2. Mirror treatment क्या है, इसको होता क्या है? Now, I'd strongly want to advise you all. Now, you might as well YouTube phantom limb pain, and you'd come across, number one, you know that no one to this date knows the exact cause behind this, exact reason why this happens, and the exact reason why and how someone is experiencing pain in a part of the body that physically does not exist. I'm sure you've heard at some point or the other कि ये आपके दिमाग में है, तो दिमाग का या साइकोलॉजी का यहाँ पे किस हद तक अमलो दखल है, and or what role does psychology play over here, where you, yeah, so you'd come across amazing videos on phantom limb pain. You'd come across people who have been experiencing phantom limb pain, and you'd come across mirror treatment as well, where you'd be able to see Mr. Ramachandran as well. So, like I said, this is very unconventional, unorthodox, but it is what is working for people, for many people, not all, of course, so far. So, some sufferers experience success with mirror treatment. Now, what is this mirror treatment? Where the remaining limb, where you go, where the remaining limb is put into a box with mirror down the middle. So there's a box. Let's just say there's someone who lost his one of his leg below the knee, the right leg. Let's just make it visualize this. So you make the person sit or lay down, and you place the remaining leg on one side of the box, and there's a mirror that is there. Now, because there's a mirror that is there, and on the other side of the box, you have that imputed limb, or the limb that physically does not exist. एक साइड पे अगर बीच में आपने मिरर रखा हुआ है, तो आप एक पर्टिकुलर एंगल पे उसका रिफ्लेक्शन देख सकते हैं, a reflection of that actual limb. Now, I mean, this was imputed. So if I talk about this uh, limb that physically does exist, or this arm that physically does exist, बीच में एक मिरर है, आप फिगर आउट कर सकते हैं कि आप फिगर आउट क्या कर सकते हैं, बीच में मिरर है, तो आप एक पर्टिकुलर एंगल से आपको रिफ्लेक्शन नजर आएगी अपने रिमेनिंग लिम्ब की. दैट वुड मेक योर, so you're actually tricking your brain, you're convincing your brain that 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 a limb exists physically, when in reality it does not exist physically. So as simple as it could be. So when viewed at an angle, it looks to the patient as if they have two intact arms or legs. The patient then takes part in a range of movement exercises. So a range of movement exercises. And this eventually leads to a reduction in phantom pain in some patients. Of course, in some patients and not all. And that I think makes sense too. So we spoke about phantom limb pain, and yes, I wanted to show you through a 6-mark question, because yes, we've had a question on this, and we'd be able to understand this phantom limb pain better as we'd study the gate control theory that was in bullet number 2. And yeah, no, thank you. So let's get back and continue with what we were doing. Mirror treatment. Now, this is how it is like. This is an individual who has, let's just say, let's just mark this as the individual's left leg, and that is, I'll write the word real because this exists, and this is a mirror over here, and through the mirror, the individual is able to see a reflection of his uh, image. So this person, this is his left leg, this is his uh, yeah, so on the other side of the mirror, there's this right leg that in reality does not exist. And this patient sees a reflection. This is a reflection of, this one is a reflection of the real leg, which tricks his mind to believe that the left leg exists. So, it's pain, since we're referring to it as phantom limb pain, phantom fake, and not real. And this doesn't necessarily and only has to be pain. This could be tingling effect. This could be uh, your fingers clenched, and God forbid, this is super annoying and happens with more people than you think it does. There's literature that claims 70%. There's literature that also claims 90% of the people who experience an amputation experiences. Uh, Yeah, and if you know of someone, God forbid, who does not have a limb, I mean, it would be mean to go and ask them straight. If you could figure out a way to figure it out. Most people, because there are some people that I know of, two at least that I can recall of right now, and they have experienced this. Now, taking this ahead, Bismillahir Rahmanir Rahim. Mirror treatment for phantom limb pain. Ramachandran and Rogers Ramachandran in 1996 used mirror treatment to help patients who experienced phantom limb pain after an arm amputation. This is an image from Google that shows a leg, but nonetheless, it's the uh, same logic, same process, same success rate. And ahead, we have an example study by MacLachlan, and through that example study, we'd see how it worked for uh, this individual who's named as Alan, and it's a case study because we talk about a single individual here. So in this treatment, the patient places their remaining limb inside a box with a mirror in the middle. When the patient looks at the mirror from a certain angle, it creates the illusion that they have two normal limbs. The patient then performs different limb movement exercises, which is again, you'd see this in the example study that we have in a syllabus ahead, while watching the mirror or reflection. For some patients, this reduces the feeling of phantom limb pain, although others may experience little or no improvement. So just like the normal conventional medicines or uh, psychological therapies, this does not work for all. And yes, it works for some people, which is again uh, super helpful for them because और तो कोई तरीका नहीं है इसका इलाज का. Now taking this ahead, Bismillahir Rahmanir Rahim, let's talk about this example study. This example study, of course, if you read through this, like I suggested, if anyone is interested in the content that you see on the screen, you might as well be taking screenshots along the way. MacLachlan et al. In 2004 reported a case study. This is a case study on the use of mirror therapy to treat phantom limb pain in a lower limb amputee. The participant, that is Alan, a single participant की बात कर रहे हैं, 32-year-old man who has his leg amputated at the hip during life-saving surgery. God forbid, let's just say the person had an accident, eventually had to let go of his leg. And I'm sure it was something serious, and that is why it says during a life-saving surgery. And later began experiencing phantom limb pain. अच्छा, कुछ लोग पूछते हैं ये कब तक चलता है? अक्सर औकात हमेशा. This is with you the entire, throughout your life. And this is bad. And yeah, go Google this, YouTube this, and you'd come across a lot of videos that would show you how real it is and how bad it is. And later began experiencing phantom limb pain and sensations such as crossed toes and pins and needles. Imagine you experiencing sensations like crossed toes. Uh, if it would have been the real limb, the limb that exists, that actually does exist, you could have walked yourself through and you could have come up with a way to fix it. But over here, we're talking about a situation where you're experiencing a sensation such as crossed toes and you're trying to disentangle them, you're trying to let go, you're trying to set yourself free, you're trying to make yourself feel a little comfortable. लेकिन कैसे आप कर ही नहीं सकते because वो limb physically exist ही नहीं करती. So began experiencing phantom limb pain and sensations such as crossed toes and pins and needles. Previous treatments such as pain medication or this okay, so this physical they were so this gentleman, he tried getting himself treated through pain medication, through uh, TENS is transcutaneous electric nerve stimulation. Now this part we would study this part when we be covering the third section. मैं एक नजर आपको दिखा भी देता हूँ. The third section, यहाँ पे हम इसके बारे में पढ़ेंगे. We study about using medicines as so medicines again come under the heading of biological treatment, biochemical treatment. We've already studied clinical psychology. यहाँ तक तो you all would have an idea. And an alternative form of treatment is TENS, that is transcutaneous electric nerve stimulation. तो ये दोनों चीज़ों के बारे में हम पढ़ेंगे. But अभी के लिए just know that these are treatments or these are ways through which individuals try to control or if not control, maybe manage pain. So taking this ahead, Bismillah ar-Rahman ar-Rahim, previous treatments such as pain medication and transcutaneous nerve electric nerve stimulation did not work for this gentleman, Alan. Now, the conventional methods did not work. Alan used mirror therapy, performing a 10 leg and foot exercises, not performing 10 leg and foot exercises while looking at the reflection of his intact leg in a mirror box, creating the illusion that both legs were present. The exercises were carried out several times a day for 3 weeks. Over time, phantom limb sensations and pain decreased. So, mirror treatment actually did work for Alan. Over time, phantom sensations and pain decreased, and by the end of the program, Alan rated his phantom pain as 0. So this is 0. So this mirror treatment actually did work for Alan, and yes, just because it worked for Alan doesn't necessarily mean it would work for everyone else. But yeah, this is a case study. And of course, if it's a case study, the good things about a case study, we have detailed amount of information. And the bad thing about a case study over here, this you might not be able to generalize from the findings that you've had from this particular study. So over time, phantom sensations and pain decreased, and by the end of the program, Alan rated his phantom pain as 0 and reported greater control over the phantom limb. So now the gentleman could actually control his phantom limb. Remember the different sensations here, here, and here. So the study concluded that mirror therapy can be effective treatment for phantom limb pain in lower limbs. So in lower limbs, at least, I'd want to highlight this. Now, taking this ahead, let me walk you through the syllabus again. This is what we were doing. I'll just wipe it clean so that you see, we've done covering the first bullet from the first section from the third chapter, pain from health psychology. And like I typically put it, when you're studying content, when you're trying to understand, when you're trying to learn, see it as your potential 6-mark question. So today you've had a question on, I did show you a 6-mark question that we had in November 2025, variant 3.2. And variant 3.2 works for zone 4. Zone 4, Pakistan falls into zone 4. Just know this. And let's take this ahead. Bismillah ar-Rahman ar-Rahim. And let's evaluate MacLachlan et al.'s example study, a case study. Yes, this is a case study too, because we're just referring to a single individual with the name Alan. Individual versus situational explanation. and the study mainly supports an individual explanation because the treatment focused on Alan's personal experiences. It was a case study of phantom limb pain and his individual response to mirror therapy. However, because the study involved only one participant, it is difficult to know whether the same results would occur in different situations or with other patients. So this is, I mean, this is one way to put it. You do have alternative ways to. uh, why is it that I mentioned this here? I put this slide here so that you know that if you're getting a question on, so this question, the examiner did not. Let me just show you that question again. See, over here in this particular question, the examiner hasn't mentioned the study by MacLachlan because it's an example study. But yes, you can use content. I'll just show you something that's more relatable to what we just did. Clearly, now this is individual situation explanation, what we were discussing right now. Clearly, most of the types of pain are situation and cause. However, the experience of phantom limb pain and treatment of could be more individual. Treatment of what? Treatment of phantom limb could be more individual. And since I was trying to help you since we're trying to evaluate this specific particular uh, case study, you could use this one. Another way that you could use the nature versus nurture debate. The study highlights the role of nurture as a reduction in pain occurred due to an environmental treatment or mirror therapy rather than biological changes. This suggests that learned sensory feedback and visual input can influence how pain is experienced. Now, learned sensory feedback, this gentleman, Alan, as we name him, he tried or he was made to try this mirror treatment and it actually worked for him, which again taught him. And now he knows that the next time he's experiencing phantom limb pain or phantom sensations, he could actually use this technique, this mirror treatment, which would help him feel better. And that is, of course, leaning more towards the nurture side of the debate. Number three, reductionism versus holism. This study can be seen as somewhat reductionist because it focuses mainly on the visual illusion created by mirror therapy. So this focuses on the visual illusion. Illusion. Remember, I kept on using the word, you're trying to trick your brain, created by mirror therapy as the explanation for reduced pain. However, phantom limb pain is likely influenced by multiple factors such as neurological processes, emotions, and previous experience, which may not be fully considered. So, आप एक particular कोई भी स्टडी आपकी रिडक्शनिस्ट या कोई भी थ्योरी आपकी रिडक्शनिस्ट कब होती है, जब आप एक पर्टिकुलर फैक्टर के ऊपर ओवर एम्फोसाइज कर रहे होते हैं, ओवर रिलाई कर रहे होते हैं, ओवर फोकस कर रहे होते हैं, while neglecting all the alternative explanations or all the alternative methods or explanations in this case. There could be multiple factors that play a crucial role. Neurological processes, emotions, or the previous experiences that you've had. And when you study about this phantom limb pain, or as if I try to be a little more specific, if we talk about the study by MacLachlan, you see it wouldn't be wrong to refer to, because this is leaning more towards reductionist and आप एक चीज पे focus कर रहे हैं. Now, taking this ahead, you could use determinism versus free will as a debate to evaluate the study as well. The study leans towards determinism as it assumes that changes in pain perception occur due to specific psychological and neurological mechanisms that are triggered by mirror therapy. However, Alan's active participation and exercises could also suggest some role for free will. अब एक तरफ आप इस स्टडी को डिटर्मिनिस्टिक भी कह सकते हैं, एंड ऑन द अदर हैंड जब आप मिरर ट्रीटमेंट की बात करते हैं तो एलन was putting an effort himself. Alan was keen and Alan was motivated, which again is where, again, if we speak about the role that Alan played over here, that helped him control or manage his pain better. उसको हम we can't forego that. We cannot just ignore that. So as he consciously engaged in the treatment. Next methodology. This is a case study. That's the first thing that I mentioned. A strength of the case study method is that it provides detailed information about Alan's experiences, treatment processes, and changes in pain over time. However, a major limitation is low generalizability, as the findings are based on only one individual and may not apply to all patients with phantom limb pain. So we had been reading this over and over again. This might work for some. This doesn't necessarily have to work for everyone. Just like any other psychological treatment, just like any other biological treatment, medicine as well. Now, taking this ahead, Bismillahir Rahmanir Rahim, let's move on to the second bullet and talk about different theories of pain. दो मुख्तलिफ theories के बारे में बात करेंगे, and there are two theories. Let me take you back to the syllabus. There are two theories that are part of your syllabus, and it's pretty possible that you get a 6-mark question straight away on this alone, and again could be your next possible 6-mark question. So the different theories of pain, and the first one is a specificity theory, and the second one is a gate control theory. तो अब ये specificity theory क्या है और ये specificity theory gate control theory से अलग कैसे है? Before I proceed, let me walk you through the years that we have mentioned here. Do we need to learn them? No, we don't need to learn them. This is just to give you an idea that this specificity theory is old, and yeah, this is old comparatively, and this many people see this as being outdated as well, but that's one explanation or one way to explain why people experience pain, and it's good knowing. So here we see the year 1895 and here we see the year 1965. तो ग़ालिबन कोई 81 साल का फर्क है दोनों के बीच में. So specificity theory suggests that now specificity theory, understand specificity theory. Specificity theory suggests that pain has its own sensory systems, just like other senses such as hearing or vision. Pain has its own sensory systems. Our senses, we taste, we see, we hear, and we smell and touch, another sensory system, just like other senses such as hearing or vision. तो सेंसरी स्पेसिफिसिटी थ्योरी ये क्लेम करती है कि पेन के भी हमारी बॉडी के अंदर, हमारी स्किन के ऊपर कुछ सेंसर्स होते हैं, और वो सेंसर्स they play an important role. As we use the word, these specialized pain receptors, they detect harmful stimuli. Now let's just say you bumped into a fridge. Again, you bumped into a fridge and bumped into the door, you hurt your elbow. Now, if you've hurt your elbow, that means physically यहाँ पे एक चीज exist करती है, और यहाँ पे आपके पास sensory pain receptors they got activated and they were able to detect that harmful stimuli. अगर आपको यहाँ तक बात समझ में आई है, if you understood it so far, you should know by now that phantom limb pain, like I said, it is real, it does exist. You have Google, Wikipedia, YouTube, ChatGPT to figure it out. And I've explained you as much as you needed to know in terms of your CI preparation. Now, this entire idea of phantom limb pain, this negates the specificity theory, because phantom limb pain claim करता है कि phantom limb pain होता क्या? What exactly is phantom limb pain? You experiencing pain in a part of your body that physically does not exist. I was giving you an example of my, God forbid, arm, well, not my arm, my hand getting amputated. अब ये physically exist ही नहीं कर रहा, ये physically exist नहीं कर रहा, तो भी अगर मुझे यहाँ पे pain experience हो रहा है, pain feel हो रहा है, तो that is defying, denying, negating the specificity theory. क्योंकि specificity theory claim करती है कि आपके उस particular body part के अंदर कुछ sensory pain receptors होते हैं, और ये specialized sensory pain receptors ये डिटेक्ट कर पाते हैं उस harmful stimuli को. लेकिन अगर वो body part exist ही नहीं करता, तो वो pain receptors कहाँ से होंगे? Now, the body has specialized pain receptors that detect harmful stimuli. When these receptors are activated, they send nerve impulses to the brain. When these receptors are activated, they send nerve impulses to the brain. The brain interprets these signals as pain, and the brain then sends a motor response to the muscles to quickly protect the body. So, a linear way to put it, you bump into, let's make it the elbow again, you bump somewhere, and there are pain receptors that exist over here, and these pain receptors, these pain receptors get activated and they send nerve impulses to the brain. They're sending a nerve impulse to your brain, and your brain then interprets it. You hit this tuck, and this sends a signal to my brain, and then it's my brain that claims, oh, you got hurt. And then you very quickly uh, respond. There's a motor response to it as well, to the muscles to quickly protect the body. Now, the core logic over here is that that particular part of your body does exist. And of course, we're talking about nature over here. Of course, we're talking about biology over here, because biologically वो चीज physically exist करती है, तभी आप pain experience कर रहे हैं. The brain then sends a motor response to the muscles to quickly protect the body. If you touch something very hot, pain receptors in your hand send signals to the brain. The brain recognizes the pain and immediately sends a signal back to your muscles to pull your hand away from the heat. This happens automatically, and this happens very quickly too. So yeah, this was the specificity theory. Let's take this ahead and talk about an updated theory over here, that is the gate control theory. And the gate control theory, the name gate, I mean, what does a gate do? What is the job of a gate? The job of a gate is, what's the purpose? What's the function of a gate? To allow someone or to not allow someone. And the name gate control theory suggests that the spinal cord, we all know a spinal cord, right? Our spinal cord contains a gate that controls whether pain signals reach the brain or not. So according to this gate control theory, we're talking about our spinal cord. We all know what a spinal cord is. हमारे spinal cord के अंदर एक gate लगा हुआ है, not a literal gate, but yeah, हमारे spinal cord में एक gate है जो कि कंट्रोल करता है कि पेन के सिग्नल्स ब्रेन तक जाए या ना जाए. एंड ऑफ कोर्स इफ पेन signals are not traveling to the brain, that means you would not experience that pain. There's this based on this, there's this I can't recall the name. So there's a procedure that women are at times made to go through when they're to reduce labor pains. They inject in your spinal cord. I'm forgetting, I can't recall the name. So gate control theory, what was that again? Can't recall at the moment. So gate control theory suggests that the spinal cord contains a gate that controls whether pain signals reach the brain. The gate is located in the dorsal horn of the spinal cord. If you want to make it a simple dorsal horn, let's just say spinal cord ka, the पीछे वाला हिस्सा dorsal cord is the backside of the spinal cord. So there are two types of nerve fibers that send signals to the spinal cord. And what are these two types of nerve fibers here? Number one, small fibers. Number two, large fibers. Small fibers carry pain signals. Large fibers carry touch, pressure, and other skin sensations. Epidural, yeah, epidural. I think it was epidural, yeah. Thank you for your help. So yeah, epidural, yeah. So now small fibers and large fibers. Small fibers carry pain signals. Large fibers carry signals such as touch, pressure, or any other type of skin sensation. Now it's more like a battle between these two different types of nerve fibers, and where are they located? They're located in the dorsal horn of the spinal cord. आम जबान में spinal cord के पीछे वाले हिस्से में ये मौजूद होते हैं. And so let me walk you through an example here. So let's use this example that we have over here. This would be easier for us to know. And you'd be able to remember this for longer as well. So if you bang your elbow on a table, you bang your elbow on a table, my elbow, table, dung, you usually rub the injured area. So if you banged it, you bumped it, you rub this, right? Rubbing increases touch signals, that is large fiber, which helps close the gate and reduces the pain sensations. Like I uses the word, uh, this is more like a battle or a tiny little battle. So yeah, a tiny little battle between these large fibers and the small fibers. If large fibers, when the gate is closed and you don't experience pain, and if the small fibers when that is when the gate is opened and the signals are sent to your brain and then you experience that pain. So when how do the gates work? When large fiber activity is greater, in large fiber activity, देखिए हमें चोट लगती है, हमें चोट लगती है, हम rub करते हैं, and then you start feeling better. That's what we're trying to explain here. When large fiber activity is greater, the gates close, so fewer pain signals reach the brain and pain is reduced. When small fiber activity is greater, the gates open, allowing pain signals to reach the brain and pain is felt more. As simple as it could be. So if you bang your elbow on a table, you usually rub the injured area. Rubbing increases touch signals, large fibers, which helps close the gate and reduce the pain sensations. Let's evaluate these different theories of pain. But before we read through this, I would want to show you the question that we had on this. Uh, this is what the question was. And remember that 6-mark question that I've spoken about that demanded knowledge on the different types of pain and the gate control theory as well. Now, giving this read, Melzack and Wall in 1965 proposed that the spinal cord contains a gate that either prevents pain signals from entering the brain or allows them to continue. That's exactly what I was explaining you. This explains why our emotional state or expectations affect how much something hurts. The gating mechanism occurs in the dorsal horn of the spinal cord, where both small nerve fibers, pain fibers, and large fibers, that is fibers from touch, pressure, etc., carry information. When there is more large fiber activity compared to a small fiber activity, people experience less pain. When there is more small fiber activity, pain signals can be sent to the brain, so the pain can be perceived. That is when the pain gets open. Taking this ahead, this explains why we rub injuries after they happen, as this increase in normal touch sensation. Large fibers inhibit the activity of the pain fibers. Small fibers, so perception of pain is reduced. This is what is there in the marking scheme that is published by Cambridge. Taking this ahead, Bismillahirrahmanirrahim. इसको हम यहाँ पे evaluation भी देख लेते हैं. So here, I'll highlight the content that we have specifically on the gate control theory. So if we try evaluating this in terms of nature versus nurture, the gate control theory of pain is quite nature-based, as it does seem to be based upon physiology. However, the theory does allow for the way in which emotions and expectations can affect the experience of pain, suggesting a more environmental influence on the experience of pain as well. तो यहाँ पे हमने nature के support में भी पढ़ा. Where it go? I don't know if I highlighted it or I made it messier. So yeah, we have support for nature and we have support for nurture as well. So environment is again nurture. Now taking this ahead, Bismillahirrahmanirrahim. Again, the gate control. Now we try to evaluate this in terms of individual and situational explanation. The gate control theory of pain has a situational aspect in the physiological experience of pain, but also individual in that the emotion and expectation of pain affect the experience. अब ये हो गया आपका situational and this is the individual part. Like I said, take screenshots if you feel like. Reductionism versus holism. The gate control. Yeah, the gate control theory is reductionist, as it is explaining the subjective experience of pain in terms of the different nerve fibers. However, the way the individual can add to that by, say, rubbing the affected area does make it more holistic. So again, reductionist and holistic both. Number 4, determinism versus free will. Gate control theory is biologically deterministic. However, the way that our expectations of pain affect the experience is less deterministic. So yeah, biologically deterministic, less deterministic. That is, you're moving towards uh, free will. So there are other issues that you could use as well, other issues such as idiographic versus nomothetic uh, approach, applications of psychology to everyday life, and generalization. Now, this is, I just wanted you to know the relevance of what is being taught to you right now. Now, let's evaluate these different theories of pain. Number one, the nature versus nurture side. One way to evaluate the theories of pain is through the nature versus nurture debate. Specificity theory strongly supports the अच्छा क्वेश्चन हमारे पास स्पेसिफिकली गेट कंट्रोल थ्योरी से रिलेटेड था, इसीलिए वहां पे कंटेंट सिर्फ गेट कंट्रोल से रिलेटेड था. यहाँ पे we to try to evaluate both the theories that are part of the syllabus, that is the specificity theory, the Purani theory, and the Melzak's gate control theory, the relatively recent theory. So one way to evaluate the theories of pain is through the nature versus nurture debate. Specificity theory strongly supports the nature side because it explains pain as a purely biological process. According to the theory, specialized pain, biological process, and now remember that amputation example, remember the sand not existing. So, sorry, remember that, remember the example where I said you hurt a particular part of your body. There are pain sensors that are there. There's specific and specialized brain sensors that exist, and these specific and specialized brains, specific and specialized pain sensors. Yeah. So, according to the theory, specialized pain receptors detect harmful stimuli and send nerve impulses to the brain, which then interprets these signals as pain. This suggests that pain is mainly determined by the body's physiological processes. In contrast, the gate control theory includes both nature and nurture. While it recognizes the biological role of nerve fibers and spinal gate biology and nerves with biology, fibers biology, spinal cord with biology. It also explains how psychological factors such as your emotions, your expectations, and your attention can influence the perception of pain. Therefore, gate control theory provides a more balanced explanation of how pain is experienced. Just in case if you're getting a 6-mark question where they're asking you to describe and then later evaluate just the theories of pain, to aapko phir specificity theory, and then you'd be expected to write down about the specificity theory and the gate control theory both. Uh, or alternatively, you could get this question as well that you had in May June 2024, variant 3.1. Outline what is meant by the nature versus nurture debate. Paper 3 के अंदर आपके पास you do get a question on the issues and debates, at least a 2-mark question in paper 3. So you could write the extent to which human behavior is the result of our innate traits or environment. So outline what is meant by nature versus nurture. Yeah. So, or you could write nature is where behavior is caused by inborn or genetic traits. So over here, you have to write down about both the nature and the nurture side to be able to score 2 marks. यहाँ पे देखिए आपने innate traits के बारे में भी लिखा है और आपने environment के बारे में भी लिखा है, तभी जा तब I mean then only you've received, then only you'd be entitled for those two marks. So explain one strength of the gate control theory from the nurture side of the debate. So you could get a question of this sort as well. Strengths might include, so 2-mark question again. This is indicative content. So it could be any strength, but over here the examiner has chosen, has given you examples of application to everyday life, free will, holistic. Achha. Now you could use these examples for, I mean, these are examples where these are examples of you having or being able to write down about strengths. And strength is again something that you could use for evaluations. So आप अगर इस तरह के क्वेश्चन के लिए प्रिपेयर कर रहे हैं, you are preparing yourself for a 10-mark evaluative essay question too. And one more thing. Now see, today you've had a question, I mean not today, in May June 2024 variant 3.1, you've had a question on the nature side of the debate. Now, what if you get a question that says, explain one strength of the gate control theory of pain from the holistic side of the reductionist versus holistic debate, or this could be about reductionism as well. So no, see, Step one, I've given you all flashcards. The least you can do is, and by now you all should be done with at least the content that we've covered. So that's core, that's basic, that's a prerequisite, that's the ABC before you start learning CAT CAP. So once you're done with that, then you start evaluating. You cannot evaluate something if you do not know it. You cannot evaluate. जब तक आप describe नहीं कर सकते किसी चीज को, आप उसे evaluate नहीं कर सकते. Of course, this is A2, and like I typically put it, 53%, 57% pay grade RI. So the grade threshold is low, and it's low for obvious reasons, because I've seen majority of the students, they during the entire year, they don't understand the extent to which evaluations and applications and analysis and interpretations matter. And for you to be able to evaluate, analyze, interpret, apply, you need to know the core principles. You need to know your AO1 well. And AO1 is knowledge understanding. So yeah, these were different ways that could be used. Another way through which we could evaluate the theories of pain. Another evaluation could be made using the individual and situational explanation. Specificity theory mainly provides a situational explanation, as it suggests that pain is caused by external physical stimuli, such as injury, heat, or pressure. It assumes that people experience pain in a similar biological way when exposed to the same stimulus. However, the gate control theory considers both situation and individual factors. तो ये स्पेसिफिसिटी थ्योरी हो गई, या आपकी गेट कंट्रोल थ्योरी हो गई. एंड yeah, so however, the gate control theory considers both situational and individual factors. While pain signals may be triggered by injury, the theory also recognizes that individual psychological factors, such as a person's emotional state or expectations, can affect how much pain is perceived. This means that different people may experience the same injury differently, making gate control theory more effective at explaining variations in pain experience. And of course, you could bring in phantom limb pain. To phantom limb pain totally negate कर देता है specificity theory को. Taking this ahead, Bismillah Rahman Rahim, reductionism versus holism could be used to evaluate the different theories of pain as well. The theories can be evaluated using the debate of reductionism versus holism. Specificity theory can be criticized for being reductionist because it explains pain only in terms of biological processes, such as nerve receptors and signals traveling to the brain. This approach ignores the influence of psychological and social factors that may affect the experience of pain. In contrast, gate control theory is more holistic because it takes into account both biological processes and psychological influences. By recognizing that emotions, attentions, and expectations can influence where the pain signals reach the brain, the theory provides a more comprehensive explanation of the pain experience. उसी तरीके से you could write down about the deterministic versus free will debate here. And finally, the theories can be evaluated using the debate of determinism versus free will. Specificity theory is biologically deterministic, as it suggests that pain occurs automatically when pain receptors are stimulated, leaving little room for individual control over pain perception. On the other hand, gate control theory allows for more influence of free will, as individuals may reduce pain receptions through behaviors. Free will है ना, आपकी अपनी मर्जी. मुझे चोट लगी, I know, a couple of seconds ago, I have this small USB thing over here, and I didn't realize it. I know it's too tiny. I don't know if you can even see it. So this was there, and there was a particular angle. I just kept my elbow over here, and it hurt, and that was my instant reaction. So that was free will. As individuals may reduce pain perceptions through behaviors such as rubbing or injured area, which increases touch signals and helps close the pain gate. This suggests that people may have control over how pain is experienced, making gate control theory more flexible in experiencing pain perception. So yeah, these are few ways that you could use to evaluate. And this is what I had planned to do for today. And if I show you the unit pain, this is how the unit pain looks like. So in our lesson today, we're done with this first part. The second part, that is measuring pain, is what I intend on covering in the next lesson, inshallah. And I hope this has been helpful. Thank you.